Started out on a one-way train, always knew where I was gonna go next. Didn't know until I saw.
Thank you for joining us today. I'm thrilled to welcome our next inspiring guest, Inez Naidu, a distinguished managed healthcare pharmacist who has achieved remarkable success in her field. Her dedication to enhancing patient outcomes and her relentless pursuit of learning every day truly embody the spirit of J.F. Kennedy's quote, and I quote, "One person can make a difference and everyone should try," unquote. Inez's commitment and perseverance have not only shaped her career, but have also made a significant impact in the world of healthcare. Enjoy the interview. Hi, Inez. Thank you for joining us on Pull in Perseverance and welcome.
Thank you.
I hope you're well. So, to kick off immediately, just tell us a bit about yourself.
Okay, so I'm a pharmacist by profession, studied at Wits University many moons ago. I think I was out of there, say, mid-90s. I started in the retail pharmacy sector just for the internship, a short while. And then I went straight into managed healthcare pharmacy. And if you want to know why, it's because I answered an ad in the newspaper and I needed a job. It wasn't like, oh, wow, this is my new career path. And I just went straight into it, started working for Anglo American as a managed access program pharmacist for their medical aid. And then just managed healthcare all the way. What happened was United Healthcare from the US joined forces with Anglo American and formed a company called Southern Healthcare JV. And they kind of introduced managed healthcare proper in SA around 1997, 1998, thereabout. Unfortunately, that company did close down. But when they did, it was then that I was headhunted by Discovery Health and joined them ever since. I've been with Discovery for a short while, then left for about 3 years and then joined again. So on the second stint, I'm there for about 21 years now. That's how long.
Wow, that's amazing.
It's a long time.
So, I mean, you loosely say managed healthcare in your introduction, but can you give us a little bit more information as to exactly what you do?
So just to explain to you how medical aids used to work back in the day, early 90s and prior to that, it was indemnity schemes. So you join a medical aid, you pay a certain amount of money, and they have these 80-20 or 70-30 type programs. So you join and then they pay 70% and you pay 30%, and you've got a limited amount of money and that's it. And that's the end of your medical aid. And then there's a different kind of hospital benefit. Some is unlimited and some has got co-pays. When managed healthcare came in, what that actually is it's largely an American concept. It's been around for over 100 years. It's about taking pooled resources from insurance and managing the access to that in terms of what is appropriate healthcare and what is financially cost-efficient healthcare. And you do that by designing certain benefits in certain ways and making sure that the pool of funds that you're responsible for is optimized, is used most efficiently. And that's what managed care is all about. So there's a pharmacy component to it, there's a hospital component, RAD, PATH, all of that, consultations, networks, all of that comes out of one big pool of money, but the pharmacy aspect deals with a basic benefit package, a top-up benefit package. What do you get for the price that you pay? What tools do you deploy to design benefits and communicate that? How do you administer what it is that you design? So when a claim comes in, you need to electronically adjudicate it the way you designed it. So you say, this is our medicine formulary. I cover these 20 medicines. It's covered in full. Anything outside of that is covered to a reference price. Those are administration rules in pharmacy. And it covers end-to-end the entire business of pharmacy. But there's different ways and tactics that you deploy to do that. As a managed care organization, you have to be registered as one. You can't just perform managed care functions. So Discovery is a registered managed care organization with the National Department of Health, and we are accredited by the Council for Medical Schemes. So without that accreditation, you cannot perform the managed healthcare administrative function. So that's it in a
thank you.
Sure.
Thank you. That's a great explanation. So in terms of where pharmacists fit in, because there was a lot of interest in terms of exactly in managed health, where do pharmacists fit in? Because a lot of knowledge comes from actuary and the numbers, etc. How do we fit in the bigger schemes of things within this large sector?
Actually, no, the largest contribution comes from pharmacists, comes from us, right? What
That's
the
wonderful.
actuaries do is that they help us play with the numbers in terms of predictive modeling and budgets. And they tell you this is the available budget and this is what you can do. And then they kind of help project where you would be in X number of years and what the contribution premiums need to be. And that's what they do. In terms of the pharmacy benefit, you actually work in a clinical team with pharmacists, with nurses, with doctors to design that benefit package. You are very, very strongly regulated in the medical aid industry or the medical scheme industry by the Medical Schemes Act. When you work with pharmacy, it's the Medicines Act, the Pharmacy Act, what you can and cannot do, who designs medicine benefits, how you speak to people, who informs you, advises you. You follow all of that in terms of pharmacy prevailing law. So what is different is any pharmacist with pharmacy knowledge coming out of internship, let's say, can apply to medical aid to be part of it. What you need to know is what you're there to do. So you're there to design a benefit package. And then you ask me, what does that mean? You don't just write it down on a paper. You have to understand how you code the entire business of pharmacy clinically. So we have a database of all the medicines that are available in South Africa for sale. And you have to then therapeutically code that to say the active ingredient in this medicine has this World Health Organization code and name. So I can put all medicines available into South Africa in different classes and categories. This is for hypertension, that's for hyperlipidemia. This is a generic, that's not a generic. You need to develop all these coding intelligence, right? And then use it to design benefits and manage risk that way. That therapeutic product file, price file, is the brain of all risk management in managed healthcare. So even if you go to retail, you need a price file. The software vendor sells it to you to know what drugs are available, what's the generic. The software vendor tells you what is and isn't a generic. We manage our own price and product file. We clinically update it every single day. We code it with all the information that we need to manage risk. We put medicines into groups to say these are the scheme exclusions. These are covered as part of our chronic authorization programs, oncology authorization programs. This is what is allowed in hospital or what isn't. Then when you go deeper into risk management, you say, what is a pharmacy benefit management tool that I can use to act as though the system was an electronic pharmacist? So the pharmacist would tell you, no, I'm sorry, the doctor only prescribed 30 tablets over this period of time. And then the system then does that because the pharmacist builds it in to do that. So you basically acting like a pharmacist all the time, but you're using all this technology and tools to do it. But you always have to remember why you are there. You are there to make sure that as many people as possible get as broad coverage of medicines and healthcare treatment that you can afford to give them. And you're always looking at efficient ways of doing that. And when you do that, you don't work in isolation. You work with networks of providers and stakeholders in the industry that shape your world in health insurance. So you work with the government as the regulator on matters that you think are affecting affordable access to medicines. You work with the SAHPRA, the registration body, when you feel that they're not registering medicines fast enough or they're not looking at biosimilars fast enough. Or you share your information with them so they understand what's a private sector priority because they don't have access to that data anywhere else, and then we do that. You speak to doctors and pharmacists to say, will you be part of my network? So that when we send our members to you, You don't overbill or charge a certain negotiated rate with us, and then we channel members to you. And all of those efficiencies, designated service providers, networks, is all well within the ambit of managed healthcare as governed in the Medical Schemes Act. And as overseen by the Council for Medical Schemes. So they tell you the kind of tactics you can deploy as a risk manager in the space, and then you expand it as far as you can. One of the biggest roles that I play in the industry together with a team of pharmacists managing benefits is negotiating medicine prices with the pharmaceutical industry. And even though we have the single exit price legislation, so it's one price and no other price, when we negotiate these prices, it's for the whole private sector. So we use our size and scale, we use the benefit design to say, this is the size of the business, I could give it to you for this price. As the volumes go up, will you bring the price down? I will keep you on the formulary. It's marketing to the members and the doctors. We say to the pharmacies, this is the dispensing fee I will pay you. It's negotiated from the maximum allowable rate. We say, if you perform well, then you can earn this type of increase on your dispensing fee. You can be part of the network, part of the designated service provider, so that you create a journey in the private sector of a good experience for the member. They know exactly that you have an extensive network. You can go to a community pharmacy, you can go to a corporate pharmacy, a Clicks or a Discount or wherever it may be, and you know Discovery has negotiated the dispensing fee rates. They're a partner who understands the benefit design and how to navigate it, so you'd expect to pay fewer co-payments, if not any co-payments, because that network provider is a partner to us. So it's a wide range of activities that ensure that what you design is understood by everyone, it's accepted by everyone, it's followed by everyone to help the member have a good and affordable experience at the end of the day.
No, thank you. Thank you for that explanation. While you were speaking, a thought came to my mind around evidence-based medicine. Do you base your decisions on evidence-based research? Am I right?
Absolutely. So for you to create a benefit package that is affordable and evidence-based, you have to use all the latest tools. You have to basically have a policy unit that designs protocols showing, the members exactly how you cover all the benefits that you offer. Health technology is a separate unit within the company. They look at every new technology, be it a surgical consumable device or a medicine. They take it through our processes. They have research databases that they reference. We consult key opinion leaders in the market over and above that when we're designing benefits. So there's lots of references and then engagement with stakeholders to make sure that that benefit is designed correctly and most affordably.
So you mentioned pharmacists across the chain in various components. How does a pharmacist get into a space like this? I mean, I also worked in managed care for a little bit, and I think it was early on in my career where it was easy to get into that space. How currently in this environment, which is so difficult, to be finding pharmacists finding it difficult to find roles, how does one prepare oneself for a role in this space?
In my view, I think you should start at university.
Yeah.
It's trained extensively in the US, been around for over 100 years. The Academy of Managed Care Pharmacies was well known in the US, and it explains all the concepts of managed healthcare, which we deploy here locally as well. We just adapt it for the South African environment. So if you teach it what risk management means, it's an area of pharmacy that's growing. I'll tell you why. Universal healthcare is, one of the goals that we have to achieve as a country, right? One of the sustainable development goals set aside by the World Health Organization. We're a member of the United Nations, and the WHO gives guidance to member countries on how best to manage country-specific policies, universal healthcare, universal access to care. This is where we need to go as a country. If you want to know what you want to do as a pharmacist. It starts there. And the education that you get, however basic it may be, versus what's going to happen when you get out there into the big world, it will help you to understand the choices that you have. And I do feel that academically, there's a gap. Because if you look at managed care pharmacists today, practically everything was on the job learning. Everything was on the job learning. And having done this for over 25 years, there's so much to teach. And yet there needs to be an avenue to start as early as possible. It would be preferable if we started it at the university. So I was very pleased that you reached out, because this was something that was playing on my mind for a while. How do you help pharmacists find their way in this space? There's going to be an increasing need for pharmacists to do this kind of work because of the growing burden of disease, not just in this country, but globally. The need to affordably give as many people access to healthcare and to medicines, to life-sustaining and life-supporting medicines, is becoming more and more important. And the challenge is increasing, because medicines that are entering the market now, novelty medicines, new medicines, are very, very expensive. And the value that they add is often not aligned with the price that it comes with. So you find that these medicines, there's a high demand, and it eats up a significant portion of the healthcare budget. But when you're starting with NHI or universal healthcare, you start with primary care, and even primary care is expensive. So you look at both sectors, private sector and the public sector, and you say, how do you serve everybody? And what kind of knowledge do you need? You need a knowledge of what's going on in healthcare in the world. You need knowledge of what's going on in healthcare in your world, as in South Africa, and then in your world, as in your life and in your job. And then it comes down to, what kind of pharmacist do I want to be? Nothing you choose is not useful to pharmacy. Always remember that. There is no bad choice, but I don't think there's enough choices, as I said earlier. If you choose managed healthcare, there's certain things you need to accept. Your work-life balance is never going to be normal. It's a sacrifice I think pharmacists make in other areas of their lives as well. But because there is this dire need to get things done as extensively as possible and as well as possible, and taking many, many things like affordability and evidence-based medicine into consideration, and negotiating this with extensive stakeholders. It takes a while, but every single year you've got to have this benefit package that's up to date and costed and affordable, just so you don't keep increasing the cost of care, where people find that it's way out of their household budget now. And you're just not going to be able to take care of the people who need your help. So if that's what you want to do, and that what is a goal that you set for your life, then it's an exciting career. I can tell you that I never have a dull moment. I don't regret doing this for a day in my life, even though you have bad days like anybody would have in any profession. I absolutely love what I do. And loving it helps you with the work-life balance, so that when you don't get it right, because you're so passionate about what you do and it feels so good to help people at a large scale. So what you do would serve millions of people all at the same time, even people you've never met. It's not about going out there and talking to you. You work on a product that has an impact on everybody's lives, because it's the cost of care from one day to another. And that's what it means. So you've really got to say, this is something I want to do. This is something I want to fight for. I want to go to war with the system that isn't quite perfect or isn't quite optimized. And you find that you become a trailblazer in this field. And there's lots more to do. Understanding what you're doing right now, and even though you have all this experience, you find the world is changing all the time. Now we're going into artificial intelligence and digital healthcare and digital health monitoring tools. And you have to adapt to all of that. But you take that knowledge and the training and the skills, and then you fit it into digital systems. If you don't do that, if you don't code it in and manage it correctly, you're not going to be able to use artificial intelligence to aggregate it and profile it. So that pharmacy knowledge is absolutely critical.
So do you think there's sufficient opportunities for pharmacists in this space?
I think so, especially as it's growing. I think even the government would need pharmacists to use this type of thinking in NHI going forward. Even if you don't have NHI rolled out the way it was originally intended, the stepwise process towards public-private partnerships and the understanding of how we give the most to patients at the best price and afford the greatest value, that's important. And you need pharmacists for that. New in this space is, we struggle to measure outcomes because you need to have a certain level of data, and data granularity. And that's the next step to be able to illustrate the value of what it is you're paying for. Because that's going to be increasingly important. The pharmaceutical companies tend to have some idea, but it is a biased view, and you need to be able to establish that from real world evidence based on what you've experienced. So that's an important area of pharmacy.
So it sounds like data science, data management is becoming more and more increasingly important, and we never would have thought that it would apply to pharmacists. So in that light, do you think having a postgraduate degree would add value in a profession like this?
I wouldn't say you desperately need it. I have it, and I used it for other things. Let's just put it that way. I now lead the medicines unit, which is involved with strategy, intensive strategy as to how you shape benefits and how you shape stakeholder engagement and manage big budgets, billions of rands in this budget. When you look at postgraduate, you're looking at it more in the specialized field. So if you're going into health technology assessment, I'd strongly recommend postgraduate. If you're going into benefit design and policy development and all of that, postgraduate has its role. But health technology, most definitely, you need a postgraduate degree. Most of the people in the team, in the policy team and the Center for Clinical Excellence, almost everybody has a postgraduate degree. But the ones who don't have it work on product, and they're excellent at what they do because of there's always a role for you to play. But when you take it to the next level of specialized care, you need that extra knowledge.
Okay, great. So not necessary, but useful if you want to specialize in a specific space.
Yes.
And in terms of pharmacists, in terms of what you've done as a pharmacist within this environment, what has been your biggest challenge, and what are you most proud of that you overcame? Considering you've been there for so long, you must have many stories, but what's the one that stands out the most?
I think, I've explained this to you simply, right? I think I've explained it to you simply, but it's a very, very complex process, complex kind of business to understand. And when you talk to people, they largely don't understand what you're saying. It's difficult for people who use the medical aid to understand why you can't get something if you need it. If you need it, therefore you must have it because I paid for it. And if you got a pool of funds, then the doctors want to use all of it for what they think is important. And when you get that balance right, when you finally help a stakeholder to understand that managing access to care is not about telling you how to treat a patient. It's not about controlling what you do in your practice. It's not about telling a pharmacist what you can and cannot do. We're telling you with available funds, this is what we can and cannot cover. Because this is all we can do with that amount of money starting from the bottom upwards. And that is a challenge to explain because the pressure to want and demand everything and anything is always there. So the slow process, extremely slow process of getting there has been rewarding because at the end of the day, the patient benefits. everything revolves around the patient.
Absolutely.
And there's something else you need to understand is that as pharmacists, we taught about illness and how to fix it. We're taught very little, if anything at all, about wellness. When you're out there and you realize this growing burden of disease, you have to integrate in your pharmacy world what wellness means, because it directly affects illness and the cost of that illness. When you are under pressure, you have to work on what mindfulness means, what taking care of yourself means, because if you can't take care of yourself, you can't take care of anyone else. And if you're in a good, solid state of mind, you have to create that balance to understand what is preventative healthcare before I get to the point of I can't afford what I really need and it's too late now. And that's an important part of pharmacy education that I think is also a gap. But you'll have to live it. You have to live it when you're in this world.
I agree. I mean, I'm coming back to your point on academics and the curriculum. And as an academic myself, it's so challenging, Inez, because we have to cover so much within a 4-year degree, which becomes immensely challenging, not just for the lecturer, but also for the student. If you think about all the sectors we have to cover, regulatory, wholesale, manufacturing, retail, hospital, it becomes very challenging to incorporate all of that. But I must say it has evolved. It has changed from when we finished our degree. At WITS, our students are lucky enough to be exposed, for example, to regulatory affairs in the 4th year, which was unheard of previously. We also teach our students a pharmacoeconomics module during their 4th year. So they are exposed to cost effectiveness, cost benefit analysis, all of those things. But what I find is because we producing generalists, it becomes very difficult. Unlike globally, where we see other pharmacy schools producing specialists, I think we're unique in that way. And therefore, I mean, that's the reason that sparked this podcast, because I think people are unaware of what exists. What professions can they actually go into? And maybe having exposure to it prior to them finishing their degree makes them a little bit more focused. Because we can't possibly do it in the curriculum, it becomes very challenging to do so. So I hope that eases your mind a little bit.
Yes, it does. No,
But
I'm very encouraged that you are exposing pharmacists or potentially new pharmacists to what's out there. Because you'd be surprised at the opportunities that we have through teaching, through business, and the value that you can add. It's just the possibilities are extensive.
Yeah, I agree. I mean, considering I did three interviews so far, and what was the common theme across all of them was the versatility that exists in the pharmacy profession. We have this ability to maneuver through different sectors of pharmacy and yet still thrive.
Yes.
Irrespective of the position we're placed in. And I think, that comes from the ability to produce generalists from the pharmacy degree. So I'm really proud to be a pharmacist and to say that we have that versatility,
Yes,
which is
so
really exciting. Yeah. So in your career thus far, did you have a mentor that guided you through this process? I mean, from what you mentioned, you didn't really think this is the path for you. But what made you
when I
stay?
started, sorry, say again.
Or what made you stay in the sector? Did
What
you
made
have
me
a
stay?
mentor?
I didn't have a mentor specifically. I used my life experience and my work experience as my guide for learning. Even though you don't have a mentor, when you're in a profession like this, that's newish to us, you observe. You observe the thinkers, the kind of thinkers that you work with. And I have had a blessed opportunity to work with exceptional people. Despite having more than one degree, despite having extensive experience, you don't go to work feeling particularly special because everybody around you is exceptional. Everybody around you is very accomplished in their own right, in their own field. So watching others and that cross-pollination of skills without having a particular mentor at any given time, you're learning every day. After all these years in the industry, there's never a dull moment, never a dull day. You're learning something all the time. And when you have that natural curiosity about how things work and how you can improve and how does it get better and how do you solve all these challenges, you're always busy, you're always thinking, you're always networking, and you're learning all the time with or without a mentor. We have a mentorship program at work right now. And yes, I am a mentor. And you get paired with people who touch an aspect of what you do, but don't necessarily understand the end-to-end business concept and purpose of what you do. And when you mentor this person, you give them that exposure. And the mentee's excitement is next level. I mean, they love this whole idea of mentorship. But back in the day, it wasn't that prevalent. But I can tell you that when you mentor others, you're teaching and learning at the same time. So it's an endless process. You never stop learning.
That's beautiful. Sounds like you're in such a dynamic space. I'm almost envious.
You can come and visit and shadow us if you want to learn at any time.
So one of the questions that came out from the viewers was, in terms of working together, I think the fascination around working together with an actuary was really caught everybody's attention. In your mind, what was the from your experience, when was the, where you almost made a decision or worked together with an actuary that revolutionized what you did? Can you think of something that was really stand out?
So I worked with actuaries from, I think, about around 2004. So the first thing we ever did is when the dispensing fees came into play, the maximum allowable dispensing fees. And now we had to decide what dispensing fee was an affordable and sustainable rate to offer pharmacies. Do you offer independent pharmacies or community pharmacies the same rate that you offer corporate or wholesale pharmacies or courier pharmacies? And how sustainable is this? So you lost all your discounting, your negotiations with all of that when it became outlawed. And then now you have to decide with the actuary what's an affordable rate. So you troll through all this data and you look at what the average markups were and you look at where the next pricing levels are going to be. And then you decide on a level and then you negotiate with stakeholders. Is this acceptable to be in a network? And actuaries will show you how you can model this in 10 different ways. So if the pharmacy community came back and said to you, I can't do this, maybe on SEP regulated products, it's one rate. And on non-SEP regulated products, it's another rate because the markups must be different. And then you work with an actuary on how best to get what is sustainable and affordable for you and what's sustainable and acceptable to the pharmacist. So yes, you work with actuaries on that kind of detail. Also, when you're looking at healthcare inflation, the actuaries determine that. They do lots of predictive modeling. If you walk in as a 25-year-old female, what might you do in 10 years from now, in 15 years from now? What would you need? If you're a child born into the scheme, what kind of services did you use? What kind of hospitalizations can you expect with certain diseases? They profile all of that using historical data. They look at current prices. They project into the future what can happen. And then they make sure that you don't get into this downward spiral or debt spiral where the scheme has to close because now you have to liquidate because you haven't correctly managed your finances. Remember, there's an objective there. The needs of the collective must trump the needs of any single individual. So you have to care for everybody. So they can do that by looking at these numbers. And the trend analytics, we look at that at our excos every week. So I sit in a team called the Risk Exco. So it's senior leaders in the team. They look at how you've been performing. So what costs have been blowing out? What resulted in that? What specialist group is now using up more services or costing more? Or what are members doing differently to what they have done before? How have the new benefits performed? Is it helping us? Is it better? Is it worse? What is it costing? And then you adjust the benefit design, you adjust the engagement, you adjust the network contracts, you adjust tariffs and rates, all based on what the actuaries are seeing based on the performance and what you need in future to keep the premium contributions as low, the contribution increases as low as possible. So that's what you do with actuaries. So if you look at a pharmacist, even though I'm a pharmacist, I am very, very involved in analytics. So I do look at the last 10 years of data, and I do categorize medicines into high-cost novelty medicines and specialized medicines, and I profile specific categories, and I then look at certain pharma companies and say to them, this is what you have done over the last 10 years, and this is a 5-year strategy that I think we can work on for you to expand your access, but this is what needs to happen on affordable access, and then we engage like that. So a lot of that happens without an actuary, but the bigger things happen with an actuary.
Gosh, it sounds extremely dynamic, like you're on your toes all the time. So when it comes to a pharmacist and working in this environment, I mean, based on your experience, what skills do you think really stand out that you've used or you use on a daily basis? Or yeah, what skills can they hone on if they
So,
want to move into the sector?
I think if you had to walk into retail, you'd ask yourself, what do I need? I need to know what a medicine does. I need to know how to use the system, administer healthcare. I need to know how medical aids work so I can help the patient navigate that. And then it's not that different when you're on the other side. You're just the one administering the care, acting like a pharmacist, telling patients what they can and cannot get. And you have to have that additional knowledge of clinical coding. As a risk management pharmacist, designing medicine benefits, putting in reference pricing, crosswalking medicines to conditions, and understanding World Health Organization coding classifications like ICD-10 codes and WHO ATC codes, and developing generic crosswalks. And that's something you must like and enjoy. Even if you're not physically doing it, because now it's built and developed, the application of that is how you apply your skills. If you're looking at reducing waste and fraud, you have to understand what is appropriate and inappropriate care. If you're not a pharmacist, you wouldn't know that this is what a medicine is supposed to be doing. You wouldn't know that this is the wrong antibiotic. You wouldn't know that, for the antibiotic stewardship, this is not what you do. All of that requires your clinical knowledge. So yes, you will know that, but you will need to top up those skills with some risk management expertise, which is not so difficult on the job learning. It grows and grows, but you can learn it. I did it. Many others have done it.
Yeah, so it sounds as if your job in this role just constantly evolves, and you, depending on which space you work in and how you maneuver through it. You mentioned AI earlier. So there's always a fear. There's always a fear that AI is going to replace the pharmacist. In your sector, do you think that's a threat?
I would just say never, upfront, never. I'll tell you why I can so confidently say that. AI does what you tell it to do. And you need a human being for it to do that. You have to explain to AI what it is you created in a database for it to aggregate it in an intelligent way, or else it throws out junk. So it's like a computer. The computer helps you to do things a lot better and faster, compute things faster than you can in your mind, but it just helps you to save time. It creates efficiency. Think about everything you could ever want as a pharmacist if you were a robot and just didn't forget anything, so that you could use your skills and your actual personality and your character to do something with pharmacy without being bogged down by all the admin. You could do so much more. You could be so much more creative. You could see so much more into your world of how efficiently you could use a certain pool of money if everything could be computed to say, this is a reasonable way and a reasonable path of doing it. This is what you've actually experienced. this is the outcome that you've actually paid for. You know, that I think is super exciting. Yes, you must have certain cautions with AI. You can't get overexcited about it without understanding what it's fully capable of doing. But I don't think it replaces us. I think it just elevates the role of the pharmacist to use AI as a tool rather than to have it replace you. I don't think the profession can be replaced. I also think more and more, as I've aged into the profession and understood it better and better, that we have not fully appreciated the human connection in pharmacy and the value that it adds when engaging with a patient or a patient population. And that's intense. We also haven't been fully integrated into the care system as one of the a legitimate caregiver as part of a proper healthcare process. And working into like multifaceted care systems to say the pharmacist does that, the doctor does that, the nurse does that, and we all work together to manage the patient care in totality, I think it's important.
So why do you think that is so, Inez? Because I also struggle with that. I think it's getting worse. It's not getting better in terms of establishing rapport with our patients. Why do you think that is happening?
I wonder if pharmacists sometimes understand that that is their role and what the importance of that role is. You work in a busy pharmacy and you've got 20 people in the queue, and you're trying to get this out as fast as possible. Is there enough of you? Is there enough time? You have to do it because it affects how that patient basically responds to that medicine. Believe it or not, it does affect the way the patient responds to that medicine. And you have to make a concerted effort. I think if you place it as something important in your life and you commit to it as something that you really want to do, you will find that it makes a difference. I can walk into a pharmacy as a patient or as a member, and I watch how I'm handled. And I say to myself, you could have done so much more with this interaction. And it would have made the world of difference. If I see that you're a youngster or a pharmacist assistant, I do tell you a few things and I guide you. And then they smile and they say, and you are, I said, one of you guys, yes. So,
I love that.
I think it's important for us. We were never really groupies. I think we should become groupies.
I agree.
Be more active for the Pharmaceutical Association. Join other pharmacists, fight for a cause, get together and do something that helps the profession. We are registered with the South African Pharmacy Council, but I'm with the PSSA and I'm with FIP, and I'll talk to anybody about something that you find interesting if you care about it. And you take the time to help youngsters and show them, what's out there. It's important. And when you engage, then you learn from each other more and more. Yes, it's important to learn from others, but I don't think we do enough learning from each other.
I agree. We're speaking the same language. I somehow feel there's a disconnect. We just don't stand unified for the causes in pharmacy. And I wish we could do more. And I hope the new generation changes that. I'm hopeful. So you mentioned a lot of financing in the conversation thus far. Do you think that's important for somebody coming into the sector to have some finance background of some sort or some certification? Do you think that's necessary?
Not per se, no, because there's always going to be a finance guy standing next to you. So there's there's a wide variety of skills, let's just say, and a cross-pollination of skills. But if you want a specialist in something, you go to that specialist right next to you. And each one helps the other one formulate the product and make sure that it's credible end to end. So I don't have any particular degree in finance. People talk to me and they think I have a law degree. I don't. You have to understand pharmacy law backwards and forwards to know what you can and cannot do. They also think I have a financial background and I don't. Again, when you work with money and you work with budgets for this length of time, you learn it on the job. It really does help to have a base level of knowledge. It always helps to read. You pick up things from people you work with. I wouldn't say these things are not necessary, but it's not absolutely critical for you to succeed. And always remember, you can study while you're working.
Yeah, absolutely.
You know, what we do in the business is we offer degrees to people who are working and on the job, courses, fully fledged degrees, all of that, so that you're always continuously improving your knowledge, apart from over and above the mentorship.
So now that you've reached, I would think, your pinnacle in your career, where do you think you go to next? Because you climbed the ladder, Inez. I mean, it's wonderful to see, and it's exciting, you're inspiring to see how far you've come in terms of growth in your career. So where do you see your next step?
Personally, I don't think it's enough. I still have lots more to do. If you say you've got like a year left to live, are you comfortable with what you've done? I would say no. I would be in a mad rush to get a good couple of things done. I really want to see, you know, better aggregation of data and granularity of data so that you can profile things and understand things. I think the universal healthcare issue is very, very important. We're a far way off from there, and we shouldn't be after all this time, because you just don't have enough information at hand to know how to do it. And there is information in the private sector, and you can get information out of the public sector, and you can work together with what you have, but you got to make it better. And so that you make sure that you don't stuff it up going forward, because you're going to have a tight budget that you work with, like I said, to provide as extensive care as you possibly can with that. So I don't think we're there yet. Yes, I've come a long way. And yes, it's been a rewarding journey, but we're not nearly done. Now we're on to the next phase of outcomes and universal healthcare and digitalization and AI, and how do we make this all better? And then look at us as pharmacists and not take all that admin in, and just take your real profession in and love it and use it and apply it, and you know, just be the next level of thinking pharmacist.
I agree with you. In my opinion, I think, the universal health or the NHI would work beautifully with private sector getting involved in the managed healthcare part of it. I think based on the decades of experience you guys have working together with government to be able to execute a formulary, for example, would be amazing. So how do you feel about that? Do you think there's sufficient engagement on that line, in that area?
There's lots going on in government in terms of putting the essential medicines list together, having the state tender process, and all of that. But collaboration would be excellent. Worked with the government quite a lot, sat on the pricing committee for a little while for the private sector. You know, we work on different projects for a little time, and you get to know each other well. But if you really want to talk about universal healthcare for South Africa, there's no way that the public sector and private sector can do this without working together. That's my personal view. I think there's lots that we can learn about challenges in the state. We shouldn't, in the private sector, profess to know things because you manage 9 million people and there's 62 million in the country. You know, biggest challenges for us, TB, malaria, all of those, the HIV, which is far more prevalent in the state than you would see it in the private sector. You have to take care of the needs of everybody. And I think there's skills on both sides that can be used to make this work. But it's going to be a process. It's a massive budget commitment. We need to figure out how to get there. But, you know, I think it's just, you just do it one step at a time. Like with any great thing you achieve, break it up into bits and one step at a time. But it's something this country needs. You have to have it. You can't carry on like this. We have to have it. We have to do something.
Yeah, I agree. That's my opinion as well. In terms of a book, is there a book that really shaped your career that you think, other pharmacists could potentially read and be inspired to follow your footsteps?
Tell you what, I used to be an avid reader in my youth, and there was a book that really resonated with me. I think it was a long time ago. I was 21. It's called Jonathan Livingston Seagull by Richard Bach. It's just about breaking away from the flock. And when you believe you really can do something and you go into it and you try and you fall and you fail and you get up again and you try, and then you see the same world you've lived in all your life completely differently. I think that's what I took from that book. And it changed my life profoundly. I think I seldomly read fiction. And I'm a fan of book hacks. So I subscribe to Uptime and I read approximately 2 books a day on Uptime, which is summarized in 5 minutes. It tells you the gist of the book.
Yes.
If you really think it's not enough and you want more, then buy the book and read it. But I really want to get to the point of why you wrote the book in the first place and what I can get out of it. So, yeah, I go through a lot through Uptime more than I actually read it. But if I had to recommend anything in terms of looking at other leaders and what they've done and what has inspired them, I'd probably go for this book called The Code of the Extraordinary Mind. It's written by Vishen Lakhiani. He's the founder of Mindvalley. Yeah. He's gone through all of this. He speaks to people to get to the meaning of why you do what you do, what makes a great leader. And he distilled all of that in this book. And you can get it on Uptime as well. But it's a book you'd want to read. It tells you that you need to forge your own path. Sometimes, even though you know it, it helps to be reminded in a certain way and encouraged in a certain way that your happiness is your responsibility. Your goals are something you need to set. If you don't set goals for yourself, you would not know what you have done with your life or where you're journeying to and when you've arrived and what you're supposed to be doing there. It doesn't have to be magnificent goals. It's just a way forward for a meaningful, productive life. That's all it is. And that's very, very important to shape the kind of professional you are, in any profession. But it's guided me as a pharmacist as to who I want to be, and that has shaped the kind of pharmacist I am.
Oh, I love that. I'm a huge fan of him, actually. I love him. I haven't read the book though. I was unsure, so thank you for recommending it. I definitely am going to go read it now. My last question before we go. So, I mean, you've been in the pharmacy sector for many years. If there's one thing that you could change, be it in legislation or in your career path thus far, what do you think it would be?
There's so many things. I think it's us working together, this collaborative working together towards a common goal. We work in silos too much in this industry, each one serving their own needs, each one saying they're doing it for the patient. But if you took a peek into everyone's world to understand the challenges and work together to find the legislation that fits the needs of the people, collectively, collaboratively fits the needs of the people, I would encourage greater collaboration of all healthcare workers to make sure that the legislation serves the patient. And we don't always get that. It's something that bugs me when you try to do the best you can, and you can only go so far because you stumped with some other bureaucracy or legislative process that just doesn't want to give in. But again, you have to use your experience, your knowledge, the information that you have to share it with others to help them understand. It's not just a conversation. You have to show them why things need to change, to encourage it to change, which is why, a couple of years ago, I published a medicine journal, 10 years of the data that we've experienced, had 2 summits in the industry, calling people in from internationally, government, private sector, collaborating, doing as much as we can to bring people together. And then I will publish more again on the medicine experience so that people can understand what has been going on in the last 10 years. So it's on my to-do list for very soon to publish the next journal. Just to show people this is actually what's happening. Cannot continue this way. This is what we can do to change it. How can you help? Just everyone has got some role to play in healthcare to help this process.
I agree with you. I think, if we all held hands together and worked together, I think patient outcomes would really improve. But also we'll see a lot more understanding in between the profession itself, amongst professionals. That would be great to see. So thank you. And thank you so much for being my guest on Pull and Perseverance. It's been extremely insightful. I learned a lot of things on managed healthcare that I didn't know before. So thank you for the time. I know you're really busy, so I appreciate the time that you've taken in your day. And
It's an
we'll
absolute pleasure.
keep
Really,
in
it has been.
touch. Thank you. I enjoyed it. Thank you so
take
much.
care. Enjoy the time with the
too.
students. Take
Thank
care.
you.
Bye.
Bye. It is clear that managed healthcare is both exciting and dynamic. This multifaceted field places pharmacists at the heart of managing medications effectively and efficiently, with the goal of enhancing patient outcomes, controlling costs, and supporting overall quality care. Key areas include formulary management, medication review, patient education, cross-team collaboration, and data analysis, amongst others. Thank you for tuning in. If you enjoyed this discussion, please like and subscribe. Stay motivated.